Hello and welcome to NIAGA Spotlight with me, Tamina Kauschi. NIAGA Spotlight goes through the week in economic analysis and future affairs. Now today, on Future Affairs, we are discussing insurance reform and prioritizing the Rakyat's well-being. Rising insurance premiums are certainly making coverage increasingly unaffordable for the average Malaysian. Health insurance premiums, of course, have surged by 10 to 15% annually. This is exacerbated by a growing burden of our non-communicable diseases, the NCDs, diabetes, hypertension, and so forth, which affects an estimated 60% of adults. In 2022, in fact, Malaysia's healthcare spending reached 30.5 billion ringgit, but insurance penetration remains relatively low at 57% only, which highlights a gap in accessible protection. Additionally, by 2035, Malaysia's aging population is projected to rise significantly, with 15.3% of the population being over 60. Now, this demographic quite naturally faces rising healthcare and insurance costs, and insurance premiums are expected to climb, creating financial distress for retirees and seniors. Simultaneously, and this ought not to be overlooked at all, the frequency of natural disasters, especially flooding, has increased due to climate change, with an estimated 2 billion ringgit in damage costs in 2021 alone. Many households are unable to afford flood insurance due to rising premiums and limited coverage options. Economic reform is urgently needed to create more affordable, inclusive insurance schemes that address the dual challenges of health and climate-related risks, which ensures greater financial security for Malaysians in both urban hubs as well as rural areas. Dato Indrani Thuraisingham, who is Vice President and Legal Advisor with the Federation of Malaysian Consumers Associations, Fomca, joins me live in the studios now for this timely discussion. Dato Indrani, a very good morning.
Very good morning, Tamina.
Thanks very much for making time. So now, this is a very timely discussion with all the dialogues which have been occurring, but can you please tell me, Dato, to start off with, from Fomca's perspective, how are the recent increases in insurance premium in Malaysia actually affecting affordability and accessibility? But let's focus on the lower and middle income groups in our society.
Yeah, I think since last year, I would say the last quarter of the year, we've received many complaints from consumers, especially policyholders, where they've received notifications of their policies premium increasing sometimes from as low as 10% to about 200%. So, for example, a policy holder would have paid 300 ringgit the previous year, now has received a notification to pay 800 ringgit for that same policy. And, so many of them have told us that, if this is the case, they would have to end up actually ditching their policies, that they would have to give up their policies, which means the numbers, as you mentioned earlier, would go down much lower in terms of accessibility to especially private healthcare.
Exactly. So when it comes to accessibility to healthcare, I think we're also talking about the fact that according to, of course, dose of statistics, it is showing that these increases are causing people to go uninsured. But when it comes to being uninsured, there's also exclusion from coverage. So let's talk about those who are not even covered yet and the urgency of getting them on insurance, which is more of a universal coverage approach, Dato.
Yeah, definitely. That's what actually Fomca we are pushing for, that, everyone should be covered ideally. And I mean, there is, of course, a lot of, arguments from the insurance industry that because the pool is quite small, that's why the premiums are high. But there are many, I would say, feasible and workable financing systems that have been in place for the healthcare systems. And I think Malaysia, we need to move towards that because what we see now is that the public healthcare is overwhelmed. And if we want everyone, especially with the statistics that you mentioned, the aging population, the NCDs, and then now you look at the climate change challenges, flood prone areas where you would actually then get waterborne diseases as well. And then when you talk about other climate-related challenges, for example, respiratory challenges because of air pollution. So now it's not only NCDs, but you also have other diseases are coming in as well. And so what you tend to see is that our population, more and more of them are actually visiting hospitals and healthcare services. So if more and more we see that, you know, that they are not able or they're not covered, so the only way they can negotiate with some of this insurance industry is that, okay, reduce my coverage so that I can pay something which is affordable. So for us, we find that government has to come in.
That's right.
Government needs to, you know, introduce a mechanism where everybody is on some financing mechanism for healthcare. It could be a social-based, you know, insurance. And we don't have to start anything at the national level. You could even start at the community level. I mean, there have been countries that have successfully implemented those kind of mechanisms where you start with the community level, pooling at the community level, and then maybe graduate to, you know, national level. But we already have a lot of mechanisms in place, like if we talk about EPF or we talk about SOCSO, where, for example, SOCSO, you know, those who are contributing to SOCSO can already, you know, go for kidney dialysis under SOCSO. So you get people who are already contributing, those who are mandatorily contributing. So it has to be a mandatory contribution. And it can be as low as, you know, maybe 10 ringgit per person per month, you know, contributing. And you'll have a national pool where, you know, at least people who are of low income, middle income, vulnerable communities, you know, for example, you have the indigenous people, you have the elderly who have, you know, who have no incomes, you know, post their retirement. These people then can be covered under this National Health Fund.
Excellent points over there. Thanks very much for giving us that really rich oversight, Dato Indrani. Now, I think the opportunity also lies in, for example, the existing scheme Perlindungan Tenang, the affordable insurance, that can perhaps have a few more premium subsidy programs that is already built within it. We've got some great regional examples, don't have to look too far. Singapore, for example, has their MediShield Life program, and that's been doing very well because it particularly targets the lower income groups. So how do you see the opportunities for actually policymakers to intervene before the next tranche of increases is actually announced? Because we're actually going to see a couple more of these anticipated over the next 3 to 5 years. So by the time we're at 2030, we could be looking at escalations of up to even 500%, etc., if there is no intermediation by the policy stakeholders.
Yes, I mean, Bank Negara did come in, you know, recently to try to cap the increase, because initially it was announced that it was going to be 40 to 70%,
right,
you know, premium increase. But with a lot of backlash from the citizens, you know, then Bank Negara has intervened to say that for the next 3 years, it's going to be capped at 10% annually. But you're talking about then at the end of 3 years, you know, by end of 2026, it would be a 30% increase,
exactly.
You know?
And is that justified? Looking at it from a very consumer rights perspective now, Dato Indrani. So, of course, over time, historically, what was initially a widow's insurance fund, that's actually the historics of how insurance developed, it has become into a profit and supply side industry. So, is it justified that it ought to be continuing at this really accelerated level when societally we are dealing with multiple polycrises, such as, of course, even climate change, right?
Yes, definitely. And for me, for Fomca, we find that even that 10% is a little bit too high. You know, it should be maybe, you know, 5%.
Yes, because
you know?
need to look whether it's going to be commensurate with income levels going up 10%,
correct.
30%, 70%.
Correct.
If that's not happening, there's no way that can occur,
correct.
right?
And we look at cost of living, you know, everything is going up. Utilities, you know, our subsidy for petrol is going to be, you know, targeted coming this year, June onwards. And usually you will see that that effect after that, the domino effect after that, when petrol prices, you know, tend to go up because where the subsidies are more targeted.
then it actually is passed on to the consumer.
Yes, at the end of the day, the consumers end up paying much more, not only for consumable goods, but also food and everything else. So my worry is that, you know, consumers will start not paying for their insurance policies.
They will just lapse their insurance
Yes,
policies.
They will lapse.
That's right.
Or they might just prioritize for their children. You know, parents would prioritize for their children because always they tend to see for the future.
That's right. Education,
and then they might,
especially.
So, and then you might see that the parents themselves might end up not continuing their policies, and then maybe they might not even continue for the elderly themselves, you know, because they might say, oh, you know, anyway, you know, what is the use? We might as well just look at our future generation. So they're going to do a lot of short-term measures, you know. But for those who really want to,
measures.
Yes, and for those who really want to ensure that they want to cover their whole family, they may end up taking up loans, you know, personal loans to kind of cover these policy, you know, premiums. So you tend to also see then they might go into financial insecurity.
That's right.
And may end up, you know, being medically bankrupt, I would say, you know, bankruptcy due to medical reasons, and not because of anything else. And you see that already happening in the US.
That's right. And of course, we've also seen recently, due to the insurance premium related increases, even cancer patients, those from middle income groups, are increasingly unable to afford their payments.
Yes. If you, I mean, if, you know, when we actually subscribe to these policies, we are told, you know, you get coverage for 33 critical illness, you know, it also includes cancer and so on. And you're under this perception that, okay, if I do contract, you know, cancer, then, you know, my insurance would cover me for my lifetime. But what happens is that, you know, when they go for a particular surgery, say, for example, removing a tumor for breast cancer, so what is covered is only the surgery and 3 months after that, you know, the post-surgery. But if you want to kind of ensure that, you know, you don't get any you know, repeat, you know, of this cancer, you know, infection, you have to continuously take medication. And these medications are all patented medicines, but they are really good medicines, and they cost, you know, around 500 to 800 ringgit per month, you know. So for the first 3 months, they're covered, but from the 4th month onwards, the insurance doesn't cover. And that's where they end up either not being able to take that medication, or they take loans, going to,
or turn to
you know,
different treatments, which of course aren't medically guaranteed. So lots of caveats do exist. Now, shifting the focus from the medical arena, thanks very much for those oversights, Dato Indrani. But let's now move stronger into looking at the current insurance policies in Malaysia, and to what extent Fomca feels that they are addressing specific needs of individuals who are being affected by ongoing climate change, natural disasters. We're talking about the flash floods, which have been occurring on an increased basis, affecting up to 9 to even 10, 11 states around Malaysia at any given time. We just recently went through another cycle of it late last year. So to what extent are the insurance policies able to actually give out the kind of payments which are required by the communities impacted?
Yes, I think at the moment now, the coverage as well as the premiums for, you know, flood-prone disasters is not sufficient. And even if you talk about our vehicle, you know, insurance, our motor insurance, this came about only in the last couple of years when we had that whole scenario of Dataran Merdeka where the cars, you know, were all flooded, and then there was that backlash that, you know, floods were not part of what we were paying for our motor insurance, you know, and then that's when all the motor insurance, you know, industry players then started including floods as part of the mandatory coverage. So I think when we talk about even property damage, or even, you know, personal insurance in terms of climate change like floods and all that, it's still not sufficient. And we're not told, you know, especially when you talk about motor, you know, insurance, or even property insurance, we're not told actually what we should be actually covering ourselves. And that's why it's not sufficient at the moment. So it should be made mandatory as part, when we are trying to cover for fire, but we don't cover for floods.
That's right.
It's automatically when you purchase a new house or something, it's always fire. But floods has not been part of that. So I think it has to be made mandatory, and there has to be that mandatory contribution as part of that when we try to purchase homes and all that. And we also then need to ensure that there is also a national disaster fund. At the moment now, homeowners, end up not having anything.
Yes, they're not included under that umbrella.
They are not.
Thailand, for example, a regional neighbor, has a national catastrophe insurance fund that actually pools together risk and provides affordable flood insurance for those in high-risk areas. Could we be looking at a model such as this, and how would we sort of operationalize it then, Dato?
Yeah, I think that's really a good suggestion, because yes, you have Thailand that does on floods. You have a very good practice also when you talk about even earthquakes. Luckily, we are not in that region, we are not prone to earthquakes. Turkey has got a very good example as well, and I think that's definitely something that Malaysia can follow through, that we have that national disaster fund, and then we use technology to identify. And I think we already know, but more and more we're getting now new places which are flood-prone areas. Before that, you had very few states and very few districts that were actually flood-prone. But now you see more and more areas being covered, especially, states like, for example, Negeri Sembilan, where I come from. We were always known as the dry state, But now
That's
you have
no
seen,
true.
now it's no longer true. Yeah. You have got districts that are actually flood-prone areas. So I think using technology to assess, the locations, and then to ensure that in these, especially in these areas, that these houses or homeowners should actually get, these kind of policies, flood-prone policies, so that they are covered, and to ensure also then in terms of processing the claims. In many countries, like for example Thailand, and even in Turkey, when you talk about other catastrophes, the processes are done within days, so that homeowners can rebuild.
Exactly.
They can
and not be left hanging in the balance.
Yes.
True.
And then, of course, then these policy claims, of course, are limited to basic structural, kind of construction.
Sure.
And I think that's possible. So I think if you follow the Thailand model, that's a very good example of, So my worry is that, we have been lagging behind. Those days, Malaysia was always #1 in terms of being in ASEAN. And I hope that, with the current, policy of us being the chair for ASEAN, that we can take leadership, not only in terms of technology being, data centers and AI, but also looking at the well-being of the Rakyat as well, in terms of economy, in terms of social, in terms of health. And I think that's where we have to show that we are not only healthy in terms of economics, but also socially, that has to be there. And maybe Malaysia needs to jumpstart, look at some of these best practices and move or surge ahead.
Exactly. It's not essential to have like a completely new policy, but integrated into the existing.
Yes. I don't think we need to come up with new systems. As I said, even if we're looking at a national health financing scheme, there's already, as I said, SOCSO, EPF, there are already models that we can work within, and start, or even then pilot something which is at the community level if we want to see whether it works in different areas.
That's right.
We could already look at some of the best practices. So not to reinvent the wheel, but look at something that is already workable. But we need to do it soon, because you can't stop aging, And if you look at NCDs, our numbers are not coming down. It's going up, So which means we're not doing something that is right. And we have these double burdens of malnutrition, and it's not only obesity, but you also have stunting and wasting, which, is going to lead to, I would say, the productivity of the country. So there are many aspects in terms of, healthcare that we need to be looking at. So it's a more holistic, I would say, ecosystem that we need to be looking at.
Absolutely.
And not looking in terms of just, in terms of treatment of, NCDs, but we need to look at the whole prevention, which, none of these insurance policies are looking at. They are always looking at treatment. But what about looking
looking at
health
incidents and outcomes, right?
What about looking at health screening? Why can't insurance, policies cover health screening? So you prevent rather than only after you contract something and then, you go for post-treatment.
And screenings can also start way before people join the workforce, for example.
Yes.
Absolutely. And I think another point to highlight is the intersection of different vulnerabilities. For example, during the recent statewide floods that we had, a majority of the deaths on the record, almost 70% were actually of elderly people who either were left behind or actually got trapped while everybody else in the area was leaving the floods. So I think it brings up the importance of just how urgent it is to have flood-related and climate risk-related insurance. Right. Now, moving on to risk-based pricing and premium adjustments. What are some of Fomca's best practice recommendations for this? Because clearly what is being looked at is only the profitability side of things for the insurance companies and the agencies.
Yes, here I would say that, we have to go for a kind of a tiered pricing,
okay.
So where you have the vulnerable or the low-income consumers being subsidized by the government. And this can be, as I said, through a national health financing scheme or a national health fund, because the out-of-pocket expenses is really high, in Malaysia. And if you look at the medical inflation, it's really high compared to the global average. I think last year it was about 15%, the medical inflation. So for us, we feel that there has to be that tiered pricing, where for those who can't afford, then they are subsidized by the government, and then where you go for those who can afford, and that's where you go into something where you can open up the pool, so the risk pooling actually brings down, I would say premiums. So if we just were to contribute 10 ringgit, but it's the total population that's contributing, then everybody can have access to healthcare. So I think the tiered pricing is important. There has to be some, as I said, some mechanism in terms of where it has to be, a wider pool of people. At the moment now, 57% is not enough. That's why our medical inflation is high. Of course, it's also contributed by the fact that when we go to private hospitals, the hospital charges are not regulated.
Exactly.
And then, so when we talk about hospital charges, it's not only the treatment, but it's also the medical devices, the drugs that is being used or being, dispensed to the patients themselves. It's usually patented drugs.
Very
and
true.
There is no transparency in terms of the drug pricing. We only are told, that, when you get your bill, it's, a 300 ringgit medication. But, we don't know at what price that it was procured at.
That's true.
So
That's
the
true.
lack of transparency in terms of even drug pricing is contributing to high cost of healthcare. So for us, we find that there are current laws already in place. Like, for example, you have the Price Control and the Anti-Profiteering Act, which is under the Domestic Trade Ministry, the End Cost of Living, which actually kind of controls or limits profiteering, unfair profiteering.
That's right.
And and it covers both products and services. So there are already ready-made provisions that we can depend on, and I think where we need to just have a little bit more clarity in terms of what coverage it covers, and drugs then can come under that. And I think this is where we need to ensure that there has to be certain reforms in laws as well. Even if you look at the healthcare, you have got the Private Healthcare and Facilities, Act.
Yes.
There has to be certain provisions there as well to
Perhaps
be amended.
some updates for it.
Yes, yeah. Because at the moment now, there are many aspects of healthcare. As I said, the healthcare charges are not regulated. It's only the cost of the doctors, you know, their charges are being regulated, but many other aspects in terms of medicines, in terms of medical devices, they are all not regulated, you know. So what you get is that, yes, they give you itemized bills. So that is so transparent, but you get a 50-page or a 30-page bill.
For the average consumer, that's a little too much to digest, and everything gets kind of lost within the legalese in a sense.
Correct.
So there's a need for not just simplification, but also ensuring increased adoption, right?
Yes.
So from there, Dato Indrani, moving into a little bit more of a concise capsule as we close out the conversation. So the consumer protection mechanisms that are available via the various acts that you have just described, or with what regularity does Fomca actually receive filed complaints, and what is the outcomes of the actions being taken? Is it satisfactory for the consumers who are, number one, aware of their rights, and then they also decide to file when something egregious occurs?
Yes, I think the main thing is actually about the disclosure.
Right.
You know, those days when we buy insurance, the agents would come and give you an A4 paper and write certain stuff on, you know,
to
how much.
explain the practice.
Yes, correct.
Yes,
you know,
that's right.
And then until you get your policy, that would be something that you rely on, and then you'll know how much you need to pay. You know, but nowadays with modern technology, agents now come with iPad. You know,
to sign you up.
To sign you up. But what they tell you is all the positive things. They don't tell you that in terms of penalty if you don't pay. They don't tell you that if you end up, you know, wanting to forfeit your policy, how much of your, you know, investments that you have put in gets forfeited. And that's the complaints that we've been receiving. Just recently, during the Christmas holidays, you know, people have been walking in, even though our office is closed and we are working behind doors, people are walking in with these kind of complaints, where, you know, they've gone to buy certain financial products, where B&M, Bank Negara, has actually said that disclosure is key, and it is mandatory that, you know, both the banking and insurance industry would have to ensure that they disclose all key aspects of the financial product. But they don't tell you, they tell you all the, as I said, the positive things. They don't tell you in terms of that, you know, after 3 years, your premiums might go up. They only tell you that, you know, there's this table, and you look at how much you will get every 3 months in terms of bonuses and things like that. But they don't tell you that if you forfeit, or the penalty charges and things like that. And I think that's where we need to improve. So in terms of the disclosure to the consumers. Secondly, I think in terms of even the financial literacy, a lot of consumers, yes, they get this thick policy, which is a 30-page, written by lawyers, you know. They don't understand. And what they do is just tell you to sign here, here, and here. But they don't tell you, you know,
about the fine print.
Yes, the fine print. All they tell you is, you know, 33 illness is covered. Cancer is covered, and that's what you hear.
Exactly.
You know?
And as we broke down earlier, there are so many issues that go with the actual ethical coverage for all the Rakyat. Dato Indrani, this was an excellent and insightful session. Thank you so much for your time.
Thank you very much.
Well, that's all we have time for today on NIAGA Spotlight, covering, of course, insurance reform and ensuring the Rakyat's well-being. We'll see you next Friday with more economic analysis and highlights. Here's to a productive week ahead.